Hi guys, thanks for joining us today. My name is Patel. I'm an emergency medicine physician at the Baylor College of Medicine here in Houston, and I'm also a full-time locums doc. I've done several of these, and I'm really excited to do another one with our speaker today, Dr. Sonya Sloan. Briefly about me, as I mentioned, I'm an ER physician. I do a bit of community medicine and academics. And I've been doing locums for about 5 or 6 years. I work in multiple states and really enjoy it for a lot of the reasons I've talked about before and a lot of the reasons Dr. Sloan will probably talk about today. I do emergency and she does orthopedics, so I think you'll get a very different perspective on different specialties and how they're able to actually make it work and why they enjoy it so much. Just a few housekeeping items. Like we always mention, you can't be seen or heard. You can submit questions. Those will get sent to me, and then we can sort of feed them into the discussion. If you have any technical problems, just log in, log back out. And then, of course, remember that this is being recorded. So if you have any questions, want to watch again, share it with anybody, you can log back onto the Locumstory blog site, and the video will be there for you to check out. So that should be it. Let me have Dr. Sloan log on. And Dr. Sloan, why don't you introduce yourself and a little bit about yourself and your really fascinating background, and we can just sort of go from there.
All right. I am Dr. Sonya Sloan, better known as OrthoDoc, hashtag OrthoDoc. I have been doing locums for approximately 14 years. And actually, October was 14 years when I initially signed up with Comp Health CHG. And so this has been a lifelong thing. This has been a career for me, which was not the norm. I graduated from Baylor College of Medicine in Houston for my residency program, UTMB Galveston for my medical school. In orthopedic surgery, I was the first Black female in general surgery as an intern, as well as in orthopedic surgery. And I finished in 2006. So sort of trailblazing a little bit. My background was a chemistry major from Texas Tech. I was, waitlisted my first year, came out and decided I was dating my husband who was at Princeton, and there was coffee houses everywhere. So I decided, I came back and told my parents I was going to move to New Jersey and work for Johnson & Johnson and wait to get into medical school. And in the interim, it was like, well, there's no coffee houses here. Why is that? And so I started a business. I was my first entrepreneurship, which is actually today, 12/3. It has been 24 years ago that I started my first business. And so since then, I've been a serial entrepreneur. I've had multiple nonprofits. The current ones are Sloan STEM Plus Arts, which specifically targets minority students for the science, technology, engineering, math, and medicine, and the arts, which is the whole audiovisual section. I also have Motivating and Empowering Women to Excel, which I've helped approximately 100 other women start their own businesses and launch their ideas and become healthier and go back to school and economically appropriate. And then recently I'm working with Black Women Orthopedic Surgeons, which is a national group. There's only 75 African-American women that are orthopedic surgeons in the country. Wow. And we have recently united. And so in doing so, it's really good because it helps me deal with a lot of the issues that I went through in residency and even in private practice today, which brings me to locums. When I came out in 2006, locum tenens was not the thing to do. And in fact, it was almost a taboo, if you will, because it was thought of that you finished, you did a fellowship, or you went to academics, or you decided that you're going to do, someplace in town or whatever else, hang out your shingle. That was the career path for orthopedic surgeon. Locums was really just now hitting the surgical fields, and a lot of people didn't see the need for it, if you will. But it satisfied my lifestyle because my husband is a pastor. We have a mega church here in Houston, north side of Houston, over 7,000 members. And so I was able to do my community work. I was able to do stuff with the church. We built a medical clinic in Haiti, the other nonprofits and all these other stuff, as well as we had 3 wonderful kids that were healthy. And after, Dr. Patel, after 15 years of being, medical school residency and all this other stuff, I just needed a break. And locums was that for me. I was able to have kids and be a mom and all this other stuff and still have it all, if you will.
Why do you think just women aren't gravitating towards, or back then to now, just towards neurosurgery or orthopedic surgery? And I know a lot of programs are now pushing towards kind of diversifying it. What do you think that is, and how challenging was it back then? I can't even imagine.
We had a conversation about this the other day, and I don't think I knew that I was one of the few. I believe I'm the first Black female orthopedic surgeon in the state of Texas.
Wow.
And it was, again, 2006. And so I didn't understand at the time going through it that there wasn't a whole bunch of women in surgery or women in ortho or neurosurgeon. And it's amazing now, the push. I think the change is definitely a movement of, trying to be equal, lifestyle change. Women are now definitely career path driven, as well as you can have it all of like, I can hire a nanny and not feel bad about that kind of thing, and a housekeeper and all this other stuff. So it's a lifestyle change. It's a thought process of change, as well as I think just with the times, it has gravitated towards a more of a neutral, anyone can be on this career path. Was it hard? Yes, it was hella hard. So people say, are you cut out for this? Orthopedics is not just about the strong, it was always the big, guy or whatever else. It was like always technique. It was always skill and enough drugs to sedate somebody to reduce something, kind of thing. So I think we got away with that persona. But also it was just the fact that for me, I hadn't been exposed, except for when I was a cheerleader and track, I was exposed to an orthopod because I was going to have surgery for my knee. And he was the coolest guy. He's like, you should think about going into this field. So I think now the encouragement of more women to go into different fields, surgical fields, is being pushed and supported.
Yeah, absolutely. Absolutely. It's funny you mentioned kind of your start. And as we've been doing more of these talks, I kind of stumbled into doing locums work because I'm sure emergency medicine is very much dominated by, it's getting very corporate now with these corporate staffing companies that are coming along. And some people jive well with them. I think for myself, I haven't, and I didn't even know there's an opportunity to do independent practice. And so I was with one here in Houston at Memorial. Well, I shouldn't maybe mention the hospital. Anyways, close by here. And let me avoid that. They can always bleep it out later. Okay. But it was actually local in town. And after I did that for a year, I then met a doc who did it and was really happy with his life. And I've been doing it for about 5-6 years. But it's funny to me because when I started, I wasn't sure the perceptions of what it meant. And I just kind of looked at it as people that in your light of lifestyle and also doing the things that they want to do with their lives and fitting in clinical practice into that. The stigmata I kind of saw later when we saw a few docs who were just like, kind of, what are you doing here? But then I also see those in normal groups of docs. But how have you kind of transitioned into it and perceptions you had going in, and kind of how's it for you now? Because I know you're pretty loyal to one place in New Mexico, I believe. Yeah.
It's funny because with the initial, so let's say we go back to 07, my first job in central Kansas, Emporia, and Newman Regional Hospital. And I was busy, and I was like taking over a practice because two of the guys had either retired or didn't want to take call. So I was it, and the money was great and the time was decent, but it was a lifestyle change. And then it was like, okay, I made enough money pretty much in 4 or 5 months to take off the rest of the year. Yeah. And so I did that. And had another baby and traveled and whatever else. I'm like, well, this is sort of good. Walking into that, a lot of people are like, why are you here? Where's your husband? You have a kid? And, so the misconceptions of perceptions of people, putting it onto you. And I was like, this works for me. I don't care really what you think, but it works for me. Then with time, it became lifestyle. There's so much burnout, of course, in medicine, that in the ER medicine. It became a thing of people are like, well, wait, how do I do what you're doing? I don't want to work, Q3 and not have a life and not see my kids and not be able to go to their dance recital or whatever else. And so it became a thing of more people wanted lifestyle change more than anything else. And so I think even now when I go in, the regular people are there, they're like, man, how's it going? I just saw that you guys were in Vail. I saw that you guys went to Mexico last year. You were in Italy last year, and it's like, I don't have time for that. I don't have the wherewithal to do that. And I'm like, but that's living, isn't it? Isn't that life? And so it just wins out. And so now people are gravitating to it. It has become the popular thing to be, oh, they're locums. And definitely now, in the climate of COVID,
Oh, yeah.
not so much for a healthy side of it, but just being able to give back and be able to participate in this, the worst medical pandemic that we've ever seen in our lifetime, to say, I've helped somebody someplace. And so people are looking for that. Yeah.
It's funny. I always say when you're deviating from a paradigm, you're going to make people very uncomfortable. You're doing things that just aren't the social norm, the professional norm. And I know that because when I saw the colleague doing it, I was like, that guy's crazy. Why would you ever want to do that? And then look at me now. I'm doing complete opposite of what I ever planned to do with my career.
Same here.
Yeah. But, I think a lot of questions I get, like things you were touching up upon, it's like travel and working with new staff and new locations. And I always tell people that's just, again, everybody travels for their job. It's not really that hard to conceive. But again, I think a lot of doctors, everything is sort of fed to us as we go. We have medical school, we have our testing, we have boards, we have, med school, residency, whatever. And then you do the match, which is just, here you go. And I think doing something like you were mentioning, entrepreneur, different is different for people. But I get a lot of questions about managing travel. And I know for you, probably a lot more family. And I think, from doing the booth, and we have our national conference, people are always, that's kind of their deterrent. Like, I could never do that. I have kids. And yet I see so many women I work with in the emergency room that they do it because of that reason. So how have you made it work for yourself?
Early on, when my kids were young, I actually took them with me. So if I was doing like a 3-month rotation or something like a 3-month stint, so Kansas was 4 months, the first one. And I took Sarah with me, and I had found a nanny there. And it was like one of the nurses was like, oh yeah, this is our nanny. She lived close by the hospital. And Dee was wonderful. She would even come to the hotel. If I was on call and I had to go in at 2 a.m, she would come to the hotel, whatever. And then fast forward, I had 2 kids, and I had like a 1-year stint I did in Baton Rouge, but I had family there. So my dad supported. I was off every other weekend. So we came home, I flew, or we drove back or whatever. So it was close enough. And then now that my kids are older, it's about support here. So I have a nanny. We have someone who just picks up the kids and transports them to, before COVID, to events, dance and karate and all this other stuff. We had someone helping cook. I have a house cleaner. So it was about, how do you have it all? It was support. You cannot do it all. You've got to have that built-in support. But for me, what I found out now, like as I go, it's almost like a release. It's almost like a mom here, like I'm going to have to fold clothes and maybe go to the grocery store or whatever. But when I go there, it's like all of a sudden you're Dr. Sloan and you're the surgeon and you're in charge. And it's a different, it's that flip side. But people, I think, gravitate to you because you bring a freshness to the environment that they're not used to, as well as an outside view looking in of like, I'm like, it's really not that big. I said, you can go to the largest McDonald's franchise hospital, or you can be in Podunk, Texas, someplace in the middle of nowhere, and the politics are the same. It doesn't matter, So therefore, when I bring that to nurses and or staff or other surgeons or whatever else, I'm like, just be you, be happy about who you are and what you're doing, and find some time to travel and do whatever else if you can't do locums.
I always argue, my dad started out as kind of a rural doc, and I always push people, and we both live, and we have so many things in common. It's crazy. We both live in Houston. We both work at we've both been at Baylor, but as Houston, with the largest medical center in the world, it's pretty saturated. There are a lot of doctors here, and we could both contribute here, of course, but I feel like my skill set, and I'm sure yours as well, is much more better served in populations that actually kind of need you more, because it's harder for people to go out there and to do those kind of things.
I think when I first started, it was like, okay, who had the contract? Where could I go? And because I was, Ben Taub, which is our level 1 trauma here in Houston, and the VA and Methodist and Luke's and Children's and Shriners and MD Anderson, I was well trained. So even though I didn't do a fellowship, I was so trained that I came out very comfortable doing trauma and sports and whatever else. So I could go pretty much any place, and they paid very well for that. So at the height of locums, I think I had 8 licenses in 8 different states. And I was able to pretty much pick and choose where I wanted to go and for how long I wanted to go, and pretty much the money. As I have gotten older, closer to 50 now, and it's about legacy living. I call it legacy living, you know, and so I can pay it forward. I can give back to communities of where I want to go. And the Navajo Nation, you know, the largest reservation in the country, indigenous people, they are loyal if you are loyal. If they know that you're coming back, and I've been there over 3.5 years now, I go once a month, you know, for 7 to 8 days, no more than 10 days. I've done at least 2 weeks sometimes, but they know I'm coming back, and it's a regular face. So I have my regular patients. I have patients that come to see me because they know I'm a regular or whatever else. But for that kind of care for people that are very, very sick and don't have what most people in medicine have, you know, healthcare, it's an honor to take care of them. And it seems like I'm making a difference, and it means much more to me, you know, than working in Fondren on 12th floor, you know.
Yeah, I know exactly what you're talking about. That's what we started. You know, it's funny, like now, because I told you I'm part-time faculty at Baylor, and a lot of what I bring to the table for them, for the residents, is really skill sets. And I mean, I've only been out of training for about maybe seven years, maybe, I think. But a lot of what I've been doing is I've hopped and worked in so many ERs in so many states and so many localities and seen so many practice models. I feel pretty comfortable, you know, not to boast, but I'd say if I don't feel comfortable working in an ER, if I don't feel comfortable doing something, I bet you most of my colleagues don't feel comfortable doing that. Right. And procedurally, I feel like I do a lot of stuff we have to. I mean, and I work with a lot of orthopedic surgeons that they only do this, they only do shoulders, they only do the small thing. They're so highly specialized. And I really love being a generalist and being able to, I'm sure for you as well, working in so many places where professionally, I know a lot of doctors stress, and of course I stressed about things, but when I go to work, I'm like, I think I feel very comfortable having worked in so many places. And I'm sure you got that experience as well.
Yeah,
as well.
We had, someone was asking me, you know, I'm into the tech side of things as well, you know, med tech. And so I'm like, you know, between Epic, which these are, you know, I mean, I'm saying it for you, but for people that are listening, you know, these are the technology softwares that we have to have. So when I came out, we went from charting to sort of combine charting, non-charting, paper to computer. So now all computer, to very complicated systems like Epic, to very, very med tech, to the VA style, to a couple other companies that have different types of software. And I've been there, done that, know how to use it. I'm comfortable. So any environment you throw me in, it's given me, like you said, that skill set to be versatile. As well as I have to go into the operating room sometimes. In literally one of the smallest places I've ever been was Great Bend, Kansas. And it was maybe a 10-bed hospital kind of thing, you know. But I was my own tech, my own scrub, my own everything. You know, I pulled my own equipment and that kind of stuff. So you have to be self-sufficient and very independent. In some places you go that they don't like that, because, you know, you have the old heads that are like, that's my job, don't do my job, you know, or whatever else. But a lot of them can appreciate, it's like, do you want a 2.0 Vicryl? I'm like, I don't care what's on the table, I'll make do, I can fix it with whatever. And so it definitely carries over and is as advantageous, I think, now, you know.
Yeah. I got a live question. It's just about CME. I maintain my CME. We have something in emergency medicine. It's like a podcast. And so I listen to the podcast, and then I do like online, you know, little quizzes, and I maintain my CME. I also just like to learn. I think I love emergency. It seems like you love orthopedic surgery. So I just like to do CME and get extra. It's not really CME to me. It's just learning and being a better doctor.
It is,
How do you do yours? Is it the same
way? Yeah. So the same way. I mean, you know, we got the typical stuff like, you know, ACLS. So you're going to get 8 or 10 hours, whatever. A lot of the states mandated that you had to have the opioid stuff, and so it was interesting. But other than that, my telemedicine, I'm into telemedicine that is not part of locums, but definitely is now playing into some of locums, even at the Indian Health Reservation. They offer, you know, just like literally on my phone, and, you know, AMA has one, and then DoxyMe has one as well, Doxy. So those are easy CME credits that you can get and then keep up. And then, of course, for orthos, the JAMA and a couple other things that we do too, and core and whatever else. But it's always interesting. I think mine is probably more diverse because I'm looking at ER. I'm looking at, you know, something that was on renal, you know, creatinine thing that came out yesterday from JBJOS. And so It's like, does that affect me? It does sometimes, and just being an outpatient someplace, and I've got to look at the labs because I may not have an internist that's going to approve something, and I've got to be more in tune. So
Right.
yeah, staying abroad on your CMEs and your credits and stuff like that is
Yeah.
definitely important. And then, every now and then I'll go ahead and I'll do a lot of lectures and do a lot of conferences, national and regional. And so of course you get larger credits for those, like the National Medical Association recently spoke at Ruth Jackson Orthopedic Society. So those give credits as well. Even though I'm a speaker, I get the credits too. So that helps.
Yeah. Yeah, I got asked, and somebody asked too, you mentioned this point before, it's about self-care. And I think people ask me how I maintain my life. And, me and I work with a few other guys and we kind of do locums together, but we have like somebody that does our driving. As you mentioned, we have people that take care of our homes. We have an assistant that manages scheduling. We have everything sort of in a working process because, as you were mentioning before, generally you get compensated more for doing locums work. And as I feel you should, because it's challenging, you're uprooting yourself to go somewhere else. Yeah. But that's how I maintain mine. Do you have any other kind of, hacks? And I have, like I said, I have everything. I bought a home 2 years ago. And so I have somebody that we just make a list, get it done while we're gone, take care of the maid. The person does the driving. They have access to all of our schedules. So it picks me up at the airport, takes me to Bush, drops me off. If we need food, it's just all automated so that, like you mentioned before, which I think is a really great point about work, professional and just personal. When I'm home, well, not right now because I'm about to go into work a little bit at Benton, but normally I'm home and I don't just dress like this for fun.
Right.
But when I'm home, I'm home. And for me, a lot of people ask me, I did another podcast for kind of like physician burnout. It was a really great podcast, but they talk about just what's next for you. And I mean, for me, what's next for me is really just being at home here in Houston, spending time with my family, enjoying being home. I've seen like me and you as well, I've traveled so much and trained in so many places. I just want to be home and spend some time at the med school. But anything else you've been doing, kind of help yourself with your care?
I do a lot of journaling. I blog. I even blog for Comp Health. I do some writing. I'm an author, that kind of thing. I'm a traveler. I love to travel. So this has really been hard, in the middle of COVID. We were actually in Mexico and had to come back early as they declared a global pandemic. But the workout, we just built a new pool. And so that the tie-in with the kids in our church, that's a lot of it. I'm a type person that I like to isolate. So even the driving back and forth, it's a 2-hour drive between Albuquerque and the reservation.
Yeah.
That's just my downtime. So music is huge for me. Love music, different type of reading podcasts.
It's very meditative. I don't think people understand, there's not many times when you just get to you can't do anything. You can't look text on your phone. You can't phone call because there's no reception.
Correct.
So
exactly.
Audiobook, podcast, and just quiet.
Vegging out. Yeah. I love it. Other than when the weather's bad. Now that's one of the downsides to, at least New Mexico. It's like the blizzards every now and then between the mountain valleys, ice and whatever else. So in this time of year, this 3 or 4 months, it's I'm really, really careful. And then Comp Health has a great company. I've worked with different companies. I've worked with several other companies as well, but the people that take care of you even on that side. So it's they know that come November, December, January, February, I need an SUV 4-wheel drive just in case, which I've needed it. The travel, even after hours, it's very critical as a woman traveling late nights by yourself in the middle of nowhere to have that access, that kind of stuff. We've changed hotels. There's been times that they put me at the hospital's house, which you get there and you're like, what the hell is this?
It's
I'm not staying there. I'm not staying there. So it was okay, can you get me Holiday Inn's down the road? I'm going to check in. So it's being taken care of that side, being comfortable. If I'm going to be someplace, I need to be comfortable and be safe, whatever. But then even here, I was telling, our Locumstory chat, I was my husband bought this new Peloton this summer.
Oh, yeah.
Yeah, no.
Yeah. Okay.
I'm trying to get into this. And so even Amy was apparently a spin instructor or whatever else. I'm that's a whole cult in itself, but finding other things to get into that are fun and that, people are involved in and that kind of stuff. It's trending, but
I think it's
I love that. I love it.
I think getting doctors to get, I think when I started doing locums work again, I was like, I have these things called hobbies, and I can
Hmm.
actually prioritize my personal life, my cousins, my family, and my things I love to do, and then kind of build my work around
Hmm.
that. You mentioned the agencies. Now, I've been doing locums for about, I think, 5, 6 years. I've been with the whole gamut. I've stayed with the bigger ones.
Yeah.
And I've had experience all over the place. Generally, my motto with agencies has been, if you haven't been doing this for a long time, probably it's not going to work out with me. I like to have agents that have experience that,
Correct.
and maybe talk to some of the doctors they work with that get to know you and that place you at places where you're going to be happy. But have you had experience? How's your experience been with agencies, and have you gone
Oh,
gone?
well, I've been sort of loyal. Comp Health, I've been with them for 14 years. And when when CHG sort of brought out the umbrella, I did some work with Weatherby, and cool, but not quite the same. I consider it sort of like the Cadillac to the Chevy.
Yeah,
You know what I mean? Like the
yeah,
levels.
yeah,
And then I have great reps. And like you said, it's like I've had a few that I'm like, yeah, they don't know what the hell they're doing. I need somebody else. And so
yeah,
like Cameron is my rep right now that has been, nonstop, always around. And then Rob he's on today. He oversees the ortho area.
yeah,
And then before him, James Peely, who's actually now moved up in Comp Health, we still send Christmas cards and whatever. So, it's friendships as well, because these people are concerned about you and trying to make sure that you're taken care of. And so, like you said, you want to make sure you have a great rep that has your back. And so I think a couple of years ago, maybe even 2 years now, I think Chad had invited me out, and they did September, Women in Medicine Month. And so they
yeah,
had different women from different fields and to come in and meet all the Comp Health team. It's like, I've been working here or working for this company for years, and to actually get to go to
yeah,
Utah and see the facility and meet the
yeah.
people in that environment was just like fantastic, because then it almost gave me a home like feeling of like even that much more loyalty that these people do care about me
Yeah.
when I'm out working in the field. Yeah.
I got to do a video for them last year. I know I went to the site. I was like, can I apply for a job here?
Yeah,
This place
me
is
too.
really
Right,
nice.
right. Forbes
Yeah.
top 100 jobs in the place.
Yeah,
Yeah, I'm
no,
like, I need to be here. Yeah, definitely.
that's great. So when you're on these reservations, I'm just curious. I'm curious about two things. One, you said patient continuity. I think that's a really great point, because I used to work at a lot of different places, and now I work at about 4 or 5, but I'm exactly the same as you. I like same staff, generally see a lot of the same patients. There's small towns and all the families. And that's
Yep,
kind of been the way. I feel like I have just 5 community jobs. I don't really think of it anymore really as locums. I just know everybody so much
exactly.
better. But how do you manage, I guess, the continuity? You said you see them all the time, but do you ever have any travel issues? And I know, like, I have a lot of people that want to do IHS work. They're very passionate about it, but they get worried about facilities, and they get worried about. I know for ER, my hesitation has just been if I get stranded, if somebody can't make it, if somebody doesn't show up, and it creates
Yeah.
murky. Like, what do you do? Things like that. Have you had that
Yeah.
happen to you, or?
We've had the weather was bad maybe a year ago. I got stuck in Albuquerque and couldn't get there. So the
Mm,
guy that was leaving was locums, and he stayed on for an extra day until I
yeah,
could get there. They've gone without. There's been one time with Harvey, I think it was during Harvey, that I got stuck here. I couldn't get there, and
yeah,
so they had an overlap of a weekend that I was supposed to be covering until the next person came in, and they didn't have anybody, so
yeah,
they sort of lose out. Have I gotten stuck there? I haven't gotten stuck there. We've had some major trauma where I got called in and I was there, but it wasn't on call yet. And they
mm,
called me in early because it was like
yeah,
major pile up. Yeah, major pile up on 40 or something. So I think you have to be flexible, definitely be flexible, and not too stern. But part of the benefit of having that liaison or that intermediate as a company, a locums company, is that it's not in my contract.
yeah,
I can't do that, so that it's a buffer, because I've had a lot of people say, why don't you just contract with IHS? I'm like, yeah, no,
yeah.
there's a lot of trade-off, that I can get with being under a company that protects me for the lifestyle I want. Yeah.
Yeah, and a lot of people, I think, and for emergency too, don't understand the agencies are there to sort of help you, place you, make sure you're happy. Of course, they're
Mm-hmm.
getting paid, but again, their focus is a lot more on doctors, and they're not involved in the hospital side of it.
Right.
Versus for emergency, I'm not sure as much. I don't know how orthopedics works yet, but I know for general surgery, anesthesia, there's specific staffing companies that then contract directly with hospitals and provide their full staffing. And so it's very different. They're much more enmeshed into it. And I feel like a lot of the things that, being concerned about your happiness kind of go to the wayside at the risk of not, they want to keep their contract.
Yeah, definitely. You're right. I think if you get bigger, if you get too much bigger and it's not that one-to-one or whatever, and like I said, having your right agent is a major thing.
Yeah.
So continuity of care for patients though is critical, just because I can see the progression. I don't do spine, I don't really care for spine. I can stabilize or whatever else, and we usually it's a level 3, so we'll ship stuff out. But we act as a level 1 with the trauma that we're in the middle of nowhere. We get everything, as well as you cover several other hospitals that call into the Indian Health Service, because you're the person like basically for all the reservation, all the other outlying hospitals. The continuity of care is good because families there really want to see that you're coming back and that you're loyal to them. They're just like anybody else. If you have an attitude or if there's a personality difference or whatever else, they will back down, and word of mouth. It becomes like, don't go to that person or whatever else. So my business when I'm there is huge, because it's pretty much like they're always, booking out and trying to come see me and whatever else. And then the trauma or the people that we take care of, it's like, I want to be treated how I would want to be treated by a stranger is how I treat someone else, so.
And as you mentioned, there's the politics are, if there are any issues there, I don't know if you've come across any, I certainly have. And I always tell people the nice thing is I don't have to go back. I'm not obligated to.
Correct.
If there's any issues, if anybody wants to make me do something, I'm working at a hospital right now. I've been there for about 2 years, and a new administrator came in, decided to bump people off shifts without, things like that. I don't get involved anymore. I just say, thank you, wish you all the best.
Correct.
Adios. Call me if you need me. But back in the day when I wanted to, be involved in this and that, and then the board, I just realized for emergency, it gets much more challenging. And I'm not saying it's not feasible for us, but as shift work physicians for us, there's just not as much being ingrained in the hospital, which we think there is, unfortunately. And a lot of hospitals honor that. A lot of them, unfortunately, don't. COVID was a great example for us of politics that got furloughed, benefits cut, and people have mortgages, kids to pay for, things like that.
Yeah, well said. Speaking of money, I think someone said something about filing taxes in multiple states.
Yeah. So I got a 3-part question here. I'll fire at it first, and then you can hit it next. The filing taxes, I use a company. They're called Fox Newman. They're based out of, I believe, Utah, actually. I just found them recently. And they actually focus exclusively on locums, tenants, physicians. And I've just started with them now, but I'm not trying to pitch them or anything here. I'm not getting any endorsement here. But
and so what did you say their name was? Fox what?
Yeah, well, let me show you the t-shirt. Hold on. I have it on right now. But they do an hourly, a monthly fee, and that includes your personal and all of your multiple state. And I had a prior tax company based out of Louisiana and Texas, and they were okay, but we didn't really have these discussions about how my income is breaking up, different contracts, how things I'm doing to minimize, trying to, tax safety and tax harboring. Obviously legal, of course, but being a PA, of course.
Put that out there,
yeah. Being an independent contractor, there's just so many things you can do to help with taxes that I just wasn't aware of. And again, for them, I really like that the monthly fees with nothing hidden, because our taxes, I work in five states total. It gets very complicated, and you need something that can maximize that. I do have times when I don't have assignments, but I try to book way in advance. And if somebody cuts my shifts, which has actually never happened until this past week for a long time, I have enough time to fill that hole. And if the hole doesn't need to be filled, guess what? That's God's way of saying, take some time off.
Correct.
Enjoy your time off.
Yes, exactly.
Somebody's saying, take a break, man. Go spend time with your parents, on the video or something. So, and as you mentioned before, Dr. Sloan, I think you make more income that you can plan. You're more financially responsible. And I don't really get guilt about people saying that I'm not. That's an interesting question. Do you get guilt about caused by peers who made you feel like you're not resilient enough to work full time? By the way, I do essentially some degree work full time in emergency. And I think when you work for yourself, you sometimes end up working more, but not at all. I mean, I feel like when I go, I work. When I'm not working, I'm off, and I'm much better as a clinician for it. So this concept of full time, I think it's kind of an archaic term for us. And I think it's more, I would actually argue spending less or more time maybe with your job, but then doing other things professionally, as you were mentioning with your business and charity work, things like that. So.
It's more fulfilling. So going back to the taxes in multiple states, I learned, I had to learn a hard lesson. So when I started in '07, getting a 990 was like, oh, okay, I got all this money, you know, stuff. And so with my husband also being on a charity side, we had a CPA that was doing our taxes, but he had never dealt with the level of money as well as, you know, the states and everything that I was dealing with. So we had to find a new CPA that was very good. I learned very early you should have a physician association and or LLC. In the state of Texas, it benefits me because it accesses multiple states for a PLLC, professional limited liability. So they can't come after me or my business or my husband. And then of course, that's all the different tax write-offs and benefits that rolls in with your 1040. So I learned a lot along the way. And have to, like you said, have a great company and a damn good CPA, because you do make a lot of money, and or I'm paying quarterly taxes, you know, that kind of thing to cover myself, because it will bite you in the ass. Trust me, it will come back to bite you in your ass, but you can do it. There's ways to do it. Did you ever find problems in between assignments? Usually mine were intentional. Like you said, I took the breaks on purpose. So it was like, not because the jobs weren't there and Cameron or James were always offering the jobs or whatever else. It was more of, yeah, I'm going to be mom right now. Or, you know, I'll be transparent. You know, we were having issues in my marriage and I needed to be here. And so it was a benefit of either having saved the money and or my husband, you know, makes good money as well. Having that surplus income that I could take off some time and sort of to do that. There was times that jobs got canceled. I had a great contract in Alexandria, Louisiana that I loved my patient population, had been there a year. They finally worked out a deal with the group in town to take call and, you know, take over the clinic. And so I was just like, I was out just like that overnight. Like literally I was there and they were like, okay, it's okay, go ahead and leave in the middle of the assignment.
Wow.
You know, so it was one of those, well, I got a contract that says you're going to pay me the rest of this week. So yeah, I'll just go ahead and leave, but you're still going to pay me. So, you know, those kind of things I've learned. And then the third part about the managing the guilt with peers. Early on, yeah, it was huge. Like I was almost embarrassed to go to my academy meetings or talk about other, you know, my classmates and stuff like that, because they were in practice and they were, you know, hardcore, and it was, you know, Q3 and they were discussing all these things. And I was like, yeah, I'm doing this locums things. It's like, what is that? Locums, you know? And now it's like people are coming to me and, you know, calling me for the advice and information about locums, because it's now a way of life that people are wanting.
Yeah, you know, and I'm all about minimizing stress these days. And I have friends, I've seen all the group models of, we have 100% RVU where you go into an ER shift, you make no money. We have the low base where you make basically no money on a shift and you have to make up the rest in RVU. And then my colleagues that go into the Democratic groups, and the best advice I got was from a woman I work with in Roswell, actually. And she was big into our national organization and she ended up leaving, but she was like, Rip, no Democratic group is truly democratic.
Right, like, exactly.
I thought about that a lot. It's
very true.
Making partnership, meeting metrics. And I'm just like, it just sounds more added stress to I think people that are gravitating towards just doing clinical medicine and separating that out from your personal life.
And we talk about this, even in my book, I talk about the fact that we don't really learn the business side of medicine. You know, it's like, at least I had like at Shriners Hospital, they would definitely tell us, you know, you go do the coding, you want the CPT at that time is ICD-9. And, you know, I had a hand guy that was like, you know, go to the office and, you know, talk to Bertha, she's in the back and she's going to show you what it looks like to make sure they're not bundled so you don't get in trouble, and make sure that they're accessing all, because that's who's making your money. And I'm like, these are things that we didn't learn unless you know, insist on going and understanding. And, you know, the first time I heard RVUs, I'm like, you mean, so I'm not going to get paid unless I meet this number? And it's like all of that. And it was like, yeah, there's easier way. There's an easier way, definitely. Yeah.
And I tell people, you know, our healthcare system has a lot of good things, a lot of bad things, but you just have to find some way to be perfect in a completely imperfect system right now.
Correct. That's a great way to put it.
Yeah, I've said it like 50 times. So
I like that.
Yeah, I mean, just try to function within a completely dysfunctional system and find a way to carve out happiness, whatever that means. And I know for me, happiness is, you know, no political involvement with the hospital. I've had I've had people, and I've had people who've they've cut my shifts. And I tell my residents, and be innately happy with your own clinical skills, not what people validate you for, because
Right.
unfortunately, a lot of people are very genuine, some people cannot be. And I think as physicians, we're very kind, compassionate people, and sometimes we get taken advantage of because they think, oh, I was the best, I was the fastest, I did that central line in 10 minutes, and nobody really cares.
No.
And you can be happy with your own clinical practice. And I know for me too, it was hourly rates for emergency. I just wanted to know how much I'd be getting paid and whatever that meant. And full-time, part-time, it's funny, when you do locums work, you set your own income.
Yeah.
And I think a lot of people get surprised. I found out I was actually working more. I just liked working a lot more. And so I was making more money. And then there are times, like I think you mentioned before, I love to travel. I love to travel. And so we basically plan trips, and we'll sort of try to work assignments around those trips.
Around it. Yeah. Same here. Yeah.
I don't like, I hate when I travel with people from America and I'm like, oh, I have like 4 days to travel because of this, or I only have 6 days. And I'm just like, oh, that's just sad, because it's really not living.
Limited.
It's really not living, Can you talk about, I'm curious, and somebody mentioned about interests outside of medicine, and I think the question was, have you found and discovered things you love to do more? I love being back in Houston. I love reconnecting with people, the food scene here, my family. I love all.
Are you a foodie? You're a foodie.
Oh my God, yeah.
And Houston's a good place to be a foodie. Yeah.
It's the best place to be. Yeah. Reconnecting with all the cultural stuff. I'm a violinist. I like going to the symphony. I take lessons now with one of the violinists in the symphony. And I'm not good. I just, like to.
Nobody has to know. Nobody has to know.
And I think for me, it's been traveling, and we're big cookers. We just love, I know a lot of doctors are into cooking because it's just like kind of scientific, but artistic.
It is. It is. I love it too. Same way.
And I know you mentioned Haiti. Yeah. I was doing more work in Haiti with a not-for-profit for many years, and then COVID sort of put that on pause. But how about yourself?
Same here.
You've been doing sort of,
with our church, I think with our church, it was more of a inroads for me. We were building, it's a Black church, Black community. Of course, with the racial divide right now in the country, that whole thing of just really trying to heal and do some positive things. But being the entrepreneur before I got into medical school really came out again later on, so even in the interim between jobs with Comp Health, it was like the passion to help other women be successful, be it medicine, be it, business, whatever it was. And so that was a gift I had. And so that was something that I just, undergirded and made sure that I was doing, and got a lot more satisfaction out of that. And so now it sort of has come back to the Sloan STEM plus arts, and it is specifically through our church and other churches that we've set up this program. 150 kids, everything from programming to electrical engineering, to them running video cameras and sound booths and understanding the audiovisual side of the arts and tech. But what for me that means, again, this whole legacy living of, in the end, that these kids may go into a STEM field that will give them sustainability for their future. And that means back into our community as well. So I see a bigger picture than just, paying for my kid to go to ID Tech Camp, which was expensive as hell. This is something that's, economical for these families. It's heartfelt because of people that are there, that are volunteer and or paid. So my in-between time of locums has found purpose and to build the legacy of what I wanted people to say later on about me.
Yeah. People always ask me in the end, kind of like the downsides of doing locums work. And I think the downsides I've come across have been like the political stuff, meaning like you mentioned with what happened with your group, it's something similar has happened to me. And I think I've learned a lot more of just, I don't like to be angry. I'm trying to be less angry in 20. I think I've done a pretty good job with a really tough year.
Considering, yes.
But I've also just been like, that's okay. Put you in the sandbox, go sit in the corner. Whenever you're ready to play fair again, that's fine. But I have multiple other places I can work, other job opportunities. The travel hasn't really been hard for me, like I mentioned, because I kind of enjoy it. And I always say, and I've said it many times, in emergency, you either lose time sleeping or you lose time traveling. You're going to do days, nights, weekends. I mainly do day shifts, and I really like that I have a more healthy, regular schedule. That's really been the bulk of it. And Negative side for me, really, I can't think of that many more. I know having work was everything negative I've thought about with locums. I've sort of kind of sat down, triangulated, figured out a work around this.
Make it better.
Somebody mentioned the personal stuff, having
Hmm.
house stuff and, family, and I have somebody that can help take care of that. So how about yourself? Have you had anything negative or?
I think initially it was the travel away from the kids initially, but that was one of those. If I was a man, it would not be really perceived a certain way. We were in a still very sexist society, and it's definitely in orthopedic surgery. You know that.
Yeah.
So getting past that, that was probably my first 2 to 3 years of practice that I was like, felt a little guilty, or I'd take to drag the kids with me, and doing it all myself, and thinking I had to be super mom when I started learning, like, just pay somebody or figure it
Yeah.
out. Like you said, triangulate and make it right and fix it, which came so much better. And then even right now when I leave, trust me, like everything is lined up and stocked, and, every agenda and schedule and whatever else is taken care of. So literally everyone is on autopilot. And then with technology, to be perfectly honest, hell, my kids bug me more when I'm gone than when I'm home, because it's like, mom, X, Y, and Z, and it's like, okay, I'm in clinic, and it's like,
Yeah.
or they'll FaceTime at the most inopportune times,
Yeah.
but at the same time, they feel like they're still connected, And then again, that great feeling of coming home and I'm all in. I don't have to worry about being on call. I don't have to worry about leaving. I don't have to worry about playing the politics or whatever else. When I'm home and I'm all in, and they
Yeah.
can appreciate that. Yeah.
Has it been hard with your significant other traveling? I know for me, we like our time apart. I know this is being recorded and she's going to see that later. And
Right. You're not getting me in trouble, man.
I know.
No, I'm not going down that rabbit hole.
We like
No,
our
we
time
have.
apart. It's funny. She actually lives, I think, somewhat close to you, actually, out in Kingwood. But we like our time apart, and then we like our time together, and we've appreciated that. And it doesn't really bother me because we have independent lives as well. Has it worked for you guys as well when you're
Same way.
gone? Yeah, same way.
We have I think becoming, when we were early on marriage, we're married 24 years now. And so 14 of that I've been with Locum. So he knows this is just our norm,
Yeah.
that she's going to be gone for that 6-7 days or whatever else. But at the same time, he's busy as well. The church is busy. It's like, as long as he has his support, it's good. And then when we are together, it's like you said, it's that all in. You value that time so much more. We travel a lot together. That's like our thing, to travel. We've been all over the world. And so it's a great experience to have that. And then distance does make the heart grow fonder. When I come home, it's a whole nother level, because like, oh, I haven't seen you for a week, the newness of it or whatever else. So it's a good thing.
You also get at your places you work, because when I'm not there for a few weeks, people are like, oh, we haven't seen you in forever. I'm like, I just saw you a few weeks ago.
Exactly.
I'm like, all right, I'm glad you haven't been a little tired of me and go a little break.
Correct.
Do you want to talk about your book? Because I was looking at it last night. It looks really interesting, and what it's about, and what.
Oh yeah. So at Baylor, being the first Black female, I learned a lot and didn't realize I learned it. I suppressed a lot and didn't understand why. And so my mom was a nurse, and we just start sort of trivializing the things you should have known before I, went into medicine or whatever else. I wish somebody would have told me. It was one of those, and I started looking for that book. And there's different types of books, but nothing on the level of just like simple, somewhat funny, somewhat serious, or whatever, quick to the point with the stories that I've learned along the way. And so it was really my payback. It was my pay it forward to those that are coming behind us, to say, somebody should tell you. These are things we talk about all the time in medicine, but you don't always get it. So if you know it, understand it early. Like rule number 1, trust no one.
Yeah.
Part of it was, hell, we're competitive to get here to where we are and on this level, but also because it's about, you check the labs, or you check the MRI, or you check, because you cannot depend on someone else when it's your name and your license on the line. It's okay to cry. It took me being in an all male program, the only Black woman, the only woman at the time, getting pregnant in the middle of having a, marital upheaval, type deal. We were in the middle of almost divorcing.
Yeah.
Because I was working so much, and then having a miscarriage. And the nurse at St. Luke's was like, Dr. Sloan, you're not the doctor today, you're the patient.
Yeah.
Be the patient, and it's okay to cry, kind of thing of like you've had a massive loss, and being able to learn those things, along the way that made it totally worthwhile, but to teach others now. And so I even do some of a book tour with different colleges and medical schools and even some high schools to talk about some of the basic things, CYA, cover your ass. It's about documentation. I don't care what you're doing, anything that you're in, that kind of stuff.
Yeah.
And then, of course, Rule 34 of pay it forward. You got to give back. You got to tell other people how you did it, how you were successful, and how can they, have the same thing.
Boy, you sound like every conversation I have with, I need to read this book now about with my residents. My residents stop looking for jobs every year. And I look at myself my first year out to not only being 7, 8 years out, but God, the amount of learning I've done and things I was just never taught in residency. Yeah. And it's appalling to me. Nobody just sat me down and said, like, medicine is a business. You're a clinician, but you need to understand how things work so that you can optimize your own practice. And, the ER, especially when we have bad things happen, and then 5 people check in with knee pain, or they have like, I need to refill on my medication, and nurses are pushing you. And I'm just like, no, you step away from me right now. I'm going outside for about just 1 minute, and do not bother me unless somebody is sick and dying, period. And if there are any issues with that, you call administration. And they know when I get that serious, that means like, let me have my moment just to reflect for a little bit. Yeah. And I think those parts of things get really stripped down when in our healthcare system now, especially through residency, you're fighting to survive and make it through. And I don't think we think about those sides of things. Trust no one. Oh my God, how many people? And thankfully, the person that changed my entire career and my life is probably one of the most malicious, nefarious, lying, cheating people who is big in administration here in Houston right now. I'm sure he knows who he is. But on the plus side, he changed my life, because if I hadn't met somebody so terrible that almost ruined everything,
same way. The biggest bully, the biggest harassment, sexually, physically, everything, emotionally, taught me probably more than anything. Taught me more than anything. So you also learn from those failures, which is also, one of the things in the book. You learn from failures. Don't, we take failure hard in medicine just because people's lives depend on us not failing, whatever. But I learned so much and valued that, and was hesitant to share it because, it's sort of like, these are the things I've learned. I'm sure there's other things people have learned, but self-care was huge. During residency, I wasn't part of the 80-hour work week. So, cardiothoracic, Bondrin, DeBakey, OR, and 146 hours in a week, out of 164. I hated life, was never suicidal, but understood. Like, we had 2 residents that killed themselves during, my residency. One was anesthesia, and one was ER. And understanding to get to that point, to get to that level, that burnout, that kind of sensation of like, that was even more of a reason why locums was great for me, because I didn't want to get to that level of hating what you did.
Yeah, we try to do like I trained in Dallas at UT Southwestern, and we try to do like a little, every shift, like a little touchy feely, where I just I'm about to go into a shift in a couple hours and just sit down and I look at everybody okay? So we need to talk. Don't
you got to.
I'm going to order you Uber Eats in about 3 hours. Everybody just relax, go to the restroom, go chill out. But definitely things I think people don't talk about, and I think that contributes to a lot of burnout and a lot of just unfortunate, just unhappiness. But I mean, like I mentioned, and I love your last point about just giving back. And I feel like with the free time that I have now, with additional income, I can really do that and contribute to things like charities, organizations. What else do you do? I know you mentioned Haiti, and you mentioned the book and the book tours. And
so
I mean, what else do you not do? It's a bigger question.
Haiti was a nonprofit called New Missions Organization. And so it started with churches. Like, we are actually go over to help build churches. And so our church is in the middle of building a church there. The organization's been there for like 40 years. Great, phenomenal thing they do. Everything from shoe boxes, just sending shoes for the kids that don't have shoe wear, spoons, something so simple to eat with because they're so used to eating with their hand, but spoons. So Christmas time, we send spoons, silverware, whatever. So we got to go over and see the school, and on the area that we were standing was during 2008 when the earthquake hit. The ground was broken up, and I saw this tile, and they were like, "Oh, that's the original clinic." I said, "Well, where's the clinic now?" And when they showed me, I brought tears to my eyes because it was like, You mean you have all these people that come and you help so many people, but you can't give them clean supplies and clean dressings and clean, or just basic stuff. And so about $100,000 later, and just raising the funds over 2 to 3 years and giving it, they built a nearly 3,000 square foot facility, fabulous, well water, clean, very nice. And now it's on the outside of Port-au-Prince on the Locum Plateau.
Yeah.
And it services about 100,000 people in the year. Mostly it's basic, neonatal care and, sexually transmitted diseases and basic cuts
Right.
and bruises and that kind of stuff. And then we can ship out. And so, and just supporting that, it's bigger than me,
Yeah.
and I have a much bigger reach. And if I can just bring attention or awareness to that, has helped tremendously. So it's a good feel. It really is. And so even now, I think with me making sure women, are going more into surgery and orthopedics and stuff like that, that's the next level of the legacy of increasing the number, with only 75 of us in the country. There's only 25 Black female residents out of 3,300 ortho in the country. And it's like, why is that?
Yeah.
So it's the awareness. It's the people telling you you can't. It's the people saying, why would you? It's that. And so I think it'll change in the next generation, and I hope to be part of that, definitely.
Absolutely. Well, Dr. Sloan, what a pleasure. This is really fun
Nice.
to chat with you.
I'm coming over to Montrose and let's get some food.
Yeah, man, you guys are in the loop, or next time out
Yeah.
there, yeah, we'll definitely hook up again. Thank you. This
Yeah.
is so great. And thank you for all the stuff you're doing and educating us. And that should be it. Thank you for everybody that participated. If you have any further questions, you can submit them later, and we can answer them later. And this will be recorded, of course. You can watch the video at your own discretion when it goes online.